health of this country and decrease the cost. But one of the points I really wanted to make is one of the things I've been thinking about a lot since I'm retired and on limited income now, is that I pay a whole lot of money for health care insurance. And the place that actually does my health care never sees any of that money unless I'm sick or unless I'm going in for tests that are not necessary and sometimes can actually be dangerous. So we have a system that benefits financially from people being sick. And that's why I think the universal health care is one of the key points in getting rid of that type of financial benefit for having people sick.
I think that that's partly because we don't pay money for preventive services. We don't pay healthcare professionals to go out into the community and work on preventing illness. We just don't. And so if we can enact a simple policy change to pay for prevention, we can suddenly make a reimbursement stream available that will promote the notion of a healthcare system that you just described.
And I'm just going to tag on that as a physician. I know I'm reimbursed probably 3 times the amount if I remove a mole or a skin tag, and versus spending 30 minutes with somebody talking about their high blood pressure or their diabetes. So that's absolutely right. The reimbursement right now is very procedural oriented, very sick oriented, and that, but I do see that changing, that the reimbursement for preventative healthcare visits will go up.
No, that's absolutely right. And the current system, a fee-for-service system, incentivizes things that are profit centers, and they aren't the things that create wellness generally. So there are some elements of the Affordable Care Act that kind of move in that direction. Some of them were deferred to later discussion to get the whole health industry, except insurance, behind the Affordable Care Act. But there are things in there such as, there are theories that we could actually pay people for the person and their wellness and not, in other words, a set capitated rate, so to speak. That's one thing that could happen. But we've already stopped paying hospitals for treatment of readmissions that they caused when they were premature and for infections they caused. They used to be able to actually profit from infections. And so that's a start, but there is a long, long way to go in doing this. I guess that gentleman there.
Yeah, so there was, hang on one second.
So I wanted to respond a little bit to something that Becca said, and I think this gets to what Shed was sharing with us as well about the attitudes of people he works with. But I hear a lot of talk. I've heard this before that what we need to really do is mobilize people to get out and vote and to threaten the jobs of elected officials. But speaking as a young person, I've lost all faith in our election system. We have an election system that is bought and sold. It's sold to the highest bidder. You have, even before Citizens United, you had a system where money controls what issues are even on the table. And I think, I would expect, I understand you're a lobbyist, and lobbyists get a bad rap, but a lot of it is because it's those with money, it's the corporations with money who can afford to pay a lot of lobbyists to go out there and